morning and welcome to 101.7 KDNO and WyoToday Newsroom. It is a beautiful day here in Fremont and Hot Springs County. Beautiful day all throughout central Wyoming. Of course, tomorrow it gets a little windy and we go into red flag warning. Actually, I think that might be today, but I think I'm not 100% sure. Need to look that up, but we will be seeing red flag warnings quite a bit this coming season, I'm sure. This morning on WyoToday Newsroom, we are joined by Kayla Sterling, LCSW. And if you're wondering, like I did, what LCSW stands for, it's Licensed Clinical Social Worker. She is helping expanding the behavioral health services in Thermopolis at Hot Springs Health Clinic. And, of course, she is a licensed professional. She's joined the team, went to Wyoming. That's always great. Go Pokes. And completed her master's work at Walla Walla University. Tell the people where that's at. Walla Walla,
That is in
Washington, I
Washington
assume.
State, and it is a real university. I know a lot of people wonder. But they have an outreach campus, a social work campus in Billings, Montana. So I could go in person at that small campus and do a couple of online classes through the university at Washington State, and that is where I received my master's.
Well, let's talk first off, Kayla, about some of the things that about what brought you here, but also, you know, in Thermopolis, in Riverton, in central Wyoming, or pretty much all of Wyoming, and across the U.S. in more rural atmospheres and more rural communities, mental health availability, mental health help, if you will, availability is at a premium and also a very low supply. Tell me how important it is to bring mental health and your expertise here to central Wyoming.
I think it's essential to add to the clinic setting especially. It allows a smooth transition from your physical health provider to a mental health provider where, like you said, it's just hard to access mental health care that's in person, for one. And there is just such an abundance of a need for people to be seen, to get help, that we just can't have enough of mental health providers for in-person care.
All right, and like we said, your background, University of Wyoming, Walla Walla University, but you also spent some time working after college, I don't know if it was between your postgrad or after postgrad, in a middle school environment. So, you know, middle school is, every parent out there who's had a middle school kid has one or has had one pass through, and luckily I'm through that. That's an awkward age, and I'll be the first one to admit it's an awkward age. You're trying to come and find yourself. So tell me a little bit about how that influenced your style, influenced how you work, influenced you personally working in Billings, Montana at a middle school.
Mm-hmm. And I actually was born and raised in Ten Sleep, Wyoming, and then left for school, went to Laramie, and then moved to Billings briefly. And while I was getting my master's is where I worked at a middle school, which allowed me to do my practicum hours and still work, go to school and everything. But that position, I actually started before my master's degree as a mental health associate. So basically I was an assistant to a therapist, helping her out with groups, doing things that are, you know, still therapeutic, but not anything that a licensed professional can do. Had to have the oversight of the therapist, and that therapist during groups and my interactions with the kids and teachers, she said, you really have an amazing ability with the kids. Like you said, it's a hard age group, an awkward age group at times, and she said, you really have an ability to get them to open up, to help them feel seen and heard. I think you should go back to school. And that wasn't something I considered. After I got my bachelor's, I was like, that's enough for me. But she really pushed me. She said, I think you would be amazing at it and be able to add something to the therapeutic community, especially for this age group. And the middle school age group, that is one of my favorite age groups to work with. I know a lot of people don't like to work with them. They can be difficult and a little spicy or sassy, but I really like working with them and have a lot of success with my style of therapy with them.
Well, and speaking of those middle schoolers, is there anything you can give the parents at home? Because one of the things I remember from, I've had 3 kids go through middle school, and I'm sure those who have them in are going through now, is, it's a very emotional time, hormones dumping left and right. Trying to find out who you are, but also it's not the most communicative group, as far as they can have a full on breakdown like in the car or something like that, and you turn around and ask them what's wrong and nothing, or I don't want to talk about it or whatnot. What can you give kind of advice to the parents at home on how you get that group to open up, or is it just sheer patience and will?
I think a lot of patience for one. During that age, various studies have shown that an adolescent's brain, the emotional part of the brain is more developed than the rational part of the brain. So
I can believe
that
it.
reactivity, that is high emotion is first, right? When they're crying and they say, I don't know. They really don't probably know what's wrong or how to put it in words, or, so I think the best thing you can do sometimes is say, well, I'm here when if there's something that you think of, or, come and let me know, we can talk about it. Or I think also making sure they know that it's okay to ask to go talk to somebody. I think the stigma of therapy is lessening, but it's still there, that kids don't want to, be seen as weird at that age or different, but I think telling them it's okay to get help, it's okay to go visit with somebody if, you see it's a persistent, crying a lot or struggling with emotions, struggling to communicate those emotions.
All right. Let's go ahead and give a shout out, because one of the things I noticed in your bio when I was going through it, trying to learn a little bit about you so I could actually conduct an interview. One of the things that you referenced and is referenced in it is your admiration for the school therapists in Billings, whose passion really for continuing your career came from her. In fact, you said you admired her approach with kids, the impactful therapy she provided them. Who's she?
Her name is Brenda Waples Hamilton, and she actually still lives in Montana, not in Billings. She lives, I believe, near the Crow Reservation.
Awesome. And it seems like through a lot of stuff that you've said about her in the past and in your bio, that she had a great amount of influence on you, that she saw something in you that maybe you didn't see yourself.
Yeah, absolutely. I didn't feel like I wanted to go back to school, being young and just, thinking I've had enough of school, and honestly didn't know if I could quite do it. And she said, you absolutely can. And she was there every step of the way, pushing me, encouraging me. When I looked at the list of classes and how long, it was about 2 years of work, and I was like, that's a lot of time. And she's like, it's going to go by fast, and you're not going to believe it, which it did. And just insurmountable support and education from her, hands-on. And she also, as a graduation gift, had given me all of her note cards, her study things for the LCSW exam you have to take to get your license. So she was there every step of the way.
Awesome. So, of course, in a region like ours, or really any region in all 50 states, or Canada for that matter, anywhere else, where it's a little more rural, mental health services, mental health resources are at a lower volume, if they exist in some ways at all. This is the same problem. I moved here from Appalachia, and we had the exact same kind of issues, as far as there was especially outside of the school system itself, there was very, very little there, if any at all. Talk a little bit about your new role here with Hot Springs Health, and a little bit different because, most people are used to, hey, I break my arm, I go to Hot Springs Health, or if I got chest pains, I go to Hot Springs Health. It's this, they do this, they set it and, kind of forget it, to quote Ronco food dehydrators with the arm or something like that. And that's not the case with mental health, is it? Mental health is a longer term. It's not just, oh, take 2 aspirin and call me in the morning.
Yeah. A little more longer term. Sometimes doesn't have to be, extremely long, but, when you're looking at take 2 aspirin, yes, it's longer term. And with Hot Springs Health, they've never had this piece with the clinics, and I feel like it just allows for, most towns, small towns do have a clinic of some sort, or they're near a clinic, a medical clinic, so it's perfect to put a social worker or therapist in that setting so that that mental health piece is accessible, as well as they have me going to Riverton, Shoshone, Thermopolis, and Worland, so that we can try to open that up for people that, maybe can't leave Riverton or can't drive far from Riverton, Shoshone, or Worland, Thermopolis. So really trying to provide that in-person care in a clinic where they often go to visit anyways, and it's often something that is in most towns.
Well, CEO Scott Alwyn says that your addition is going to fill a critical gap here for rural mental health services. Couldn't agree more. Some of your services include trauma therapy, anxiety, depression support, addiction counseling. I think we kind of all have an idea what addiction counseling is. Trauma therapy, I have a feeling we have an idea of some of it, but probably just a minuscule part, probably from like TV shows, and stuff like that. Why don't you tell us a little bit about trauma therapy?
So trauma therapy, I would say, is one of my biggest areas of expertise. I found it very fascinating as I've gone along in my career and done a lot of education training in it. I am trained in EMDR, which is another fun acronym. It's eye movement desensitization reprocessing. It is one of the best trauma treatments, most studied trauma treatments that shows, 80 to 90% success rate.
And that's the EMDR therapy, correct?
Yes.
Okay.
And it's made for trauma treatment. That's what it was first designed for, but it's also been shown to be effective for depression, anxiety, chronic pain, other pieces, because it does access that physiological part of your brain, your body, that also connects to your mental health, emotional health, and allows traumatic memories to process through the way that they were supposed to. A lot of studies have found that trauma lives in the body, that we don't even know, that it's subconscious, and we react to it throughout the day without even knowing it. So I really love to get in there and assist people with connecting those dots, relieving, like, whether it's chronic pain, emotional pain, seeing relief with the client. That's one of my favorite things to do. And there is a ton of trauma in the world now, from, little minimal trauma to major, big T trauma across the board. I think it's just an important piece to educate people on, and how that does impact mental health and physical health as a whole.
All right, and it says also one of your things, anxiety and depression support. That's really become kind of important, not of any more importance, but kind of become more seen, I think, in the past several years. As far as people talking about depression support, we have several ads run, like in our sports, that are about that kind of thing. Whether it's men seeking out support because they're less likely to do so, but anxiety support, a lot of people, everybody's anxious to a certain degree, but I think a lot of people be like, wow, there's really support for that, and don't really know it. Or maybe there's a stigma because they're sitting there going, well, I'm not depressed, I'm just anxious, I'm just on edge all the time. Talk about the importance of that and what that kind of involves with anxiety support.
Yeah. So anxiety support would be therapy for anxiety, helping people to understand, like you said, not a lot of people realize that's what it is at times, or, you know, we're designed as human beings to have a certain amount of anxiety for survival, and um, sometimes we don't notice when it becomes so heightened that it's a problem, or it's, you know, making things difficult in your life day to day. So support with that would be utilizing CBT, which is cognitive behavioral therapy, DBT, dialectical behavioral therapy, and there's tons and tons of treatment interventions that I utilize, have been trained in. I like to use an eclectic approach for anxiety or depression or any mental health diagnoses of what is most fitting for the patient, what's going to most benefit them, and what they're open to. So I use a mixture of things based off of what they need and what they would like.
One of the things that you stated, and it's in your bio, is that one of the things is you're honored to trust and assist in someone's healing process, but also, and one of the things that really hit out to me yesterday when I was reading through all this, supporting people as a move from survival to growth, because whether it's the mentality of paycheck to paycheck or things of that, or other things that happen, especially in a rural area and an area so far away from other resources, like most cities in Wyoming, just to be blunt,
Mm-hmm.
it's just the feeling of you're just trying to survive. Tell me a little
Mm-hmm.
bit about how you kind of lead them. I know that's a big open-ended question, from survival to growth, but also what it feels like when you see somebody, they kind of, whether it switches it switches in a heartbeat one day, or if it takes over time, when you see that client go from survival to just not merely surviving, but growing as a human being.
Mm-hmm. Um, so it can be across the board, just, it'll be different for each patient. They might, like you said, living paycheck to paycheck, or struggling financially. They might be referred to me to help find, different financial assistance, or help them get on their feet, that type of thing. So I see that as a small step of growth when we get them going and they're, getting back on their feet, having a little bit of help with that, as well as, the more significant things that I was always told throughout my career, that sometimes we're planting these seeds to, help them get out of survival mode, or help them have a better quality of life. We don't always get to see the growth. We don't always get to see the flowering, or, when they're doing better. But there's little moments when you asked, is it a snap thing? Is it there's, when we're doing a healing process in mental health, unfortunately, we don't go from, it's not a linear process. We don't go from, having struggles to healed in a straight shot. It's usually a circular type of journey, and you may go, around and up and down and go backwards a little bit. But seeing those, little glimmers in a session, whether it's seeing a client's eyes light up, that they have that aha moment of, oh my gosh, I understand it now, or, them saying, I feel so much better since the last session, or I was using these coping skills, or I read this book that you recommended, and I really feel like it's helping me move forward. Those little things. And then, of course, I have had the opportunity to see major growth where, someone went from being very suicidal, not seeing any kind of quality of life, not wanting to live, to, being happy to be here, getting a new job, really embracing life and having that joy that they couldn't feel before.
All right, and one of your roles obviously is you can't do it all by yourself, because you can only meet with them on certain days or appointments, things of that nature, and you have other people to see. how important are local resources and the support systems that come with them? What do we have in our local area, and what is something that we really need to grow here? Because I'm doubting we have a ton of it. But what are some things that we do have, and what do we need to grow, in your professional opinion?
So just in Thermopolis, that I didn't realize until working here, is that they do have an abundance of community entities that provide food banks and clothing banks, at various churches, and down at the town hall they have, one of those boxes that's, you can go donate food items that won't go bad, and people can come by and, take what they need. It's just a community type thing. And they also have a lot of financial assistance through different community and government groups. And Riverton, Shoshone also have, Shoshone not as many, but they do have some things that really support people that are struggling financially, or, if they need to get out socially. The community center here in Thermopolis, or even in Worland, they have a lot of free classes, yoga classes or jujitsu or different things like that, where they can go meet people and, get some exercise, which is great for mental health. So there's just a lot of different things that I think in a small area, community members really come together to fill in those gaps and do the best we can. And I think I've just seen so much amazing things like that in Thermopolis and, Riverton, Shoshone, Worland, Tinsley, that the community comes together when we need to.
One of the things your CEO had stated was he wanted to emphasize that this expansion and you coming in and things of that nature was going to ensure mental health is a core part of the patient care. And there is kind of, at least, especially, I hate to say it, with some members of my own gender who, hey, that's kind of for the weak, and, just, hey, stop being so depressed, and it's that simple. But you guys are really putting push. How do we get rid of those stigmas? But also, one of the things that y'all have done is y'all have integrated, from what I understand, mental health directly into primary care, correct?
Mm-hmm. Yes, I'm right in the clinic setting, in the middle of everything at, Worland, Thermopolis, Riverton, Shoshone. So in some of the clinics, I see patients in a clinic room. And then here at Thermopolis, there's a therapy room. But yes, it's integrated right into the clinic setting. I have times where a provider will have someone that's really struggling that's in the office with them, that if I'm available, they'll come grab me. Will you come visit with them? Or, hey, they need these resources. Can you look something up? Can you bring me something? And I'm available for that as well, to help them look for all the amazing resources that we do have that isn't advertised so well, that I think some of those things would be great to advertise them all. Or Thermopolis has a huge resource list that's a comprehensive list that if you go Google Hot Springs County resources, it's a PDF document of all different types of resources, whether it's housing, food, financial help, LEAP, DFS support. Any of those things are on that list.
And I know for some people out there, they see you as a specialist, and you are, but they see it as a specialist like a urologist, a cardiologist, what have you, and they're sitting there going, you know what, I really don't want to talk to my doctor about this, but I have to have a referral to come in. That's not the case, is it?
No, anyone can call in and schedule an appointment. Even if they're not an existing patient, they can get set up as one. I know they're working on making sure we're in network with all major insurance providers, but we are for sure. I'm able to bill Medicaid, Medicare. We do have an amazing sliding fee scale at Hot Springs Health to help if you're self-pay, don't have insurance, and can't afford it. And I think being able to integrate me into the clinic helps people to understand that mental health is a part of their physical health. That it's not a separate thing, that it doesn't make you weak if you let your provider know, hey, I'm really struggling. Is there somebody I can go talk to? or do you know of any resources? Now they have me right in the building.
All right. And one of the things, because we're going to end, for those of y'all listening who are actually thinking, you know what, this is somebody I need to talk to. She sounds great. She is. Let me just verify that for you. And you want to speak to her. At the very end here in a minute or two, we're going to give a whole host of list of phone numbers, I will, so that you know where to call. So get that pen and paper ready. But I'm going to ask you, Kayla, one of the questions I always ask, whether it's the Marine recruiters who come in when I do the show, because I got asked the same thing. Like I said, I'm from Appalachia, in northeast Georgia, actually. So I know you're from Wyoming, so we'll make it a little bit more specific. Why Thermopolis and why Hot Springs Health?
So just growing up in a small town myself, I know of the disconnect of, or the lack of resources for mental health. We have the resources for physical health. Even then, we have to, be sent to Billings, Casper. And when I saw the Hot Springs Health job description, I was like, I feel like this would really be great. And when they told me this isn't a position that we've ever had, you can kind of make it your own, I really love a challenge and was really excited about the idea of doing this, of putting a therapist in the clinics to integrate that, whole body, mind care for the people of Thermopolis, and as well as Worland, Tinsleep, Riverton, Shoshone, and have a greater impact that way. And the Hot Springs Health in general, I have been a patient myself, and I came to Thermopolis myself from Tinsleep when I was very ill, and I was treated very well and thought the provider I saw did a great job, and they have my utmost respect here at Hot Springs Health, so I love being a part of their team.
All right, and just for clarification, so people know what is available through you and through Hot Springs Health, what age ranges do you work with? What family dynamics do you work one-on-one? Do you work with couples, families, etc.? What's kind of your bread and butter?
So a little bit of everything. But I have some patients right now that are 5 years old, and I also have some patients right now that are 85 years old. So across the span, I've worked with all ages for about 11 years now. I do work with families. I've done family therapy in various settings. I've also done couples work, couples therapy, and individual work. Yeah, so there's a wide range. I wouldn't say it's limited, but if you call and say, hey, would you be able to help me with this, we can probably help you out or help you get connected to somebody that would.
All right. Okay, so here we go. We're now at the phone number part, and don't worry, I've got these written down. So you can schedule an appointment to see licensed. I'm getting confused here. To see the therapist Kayla Sterling up in Thermopolis, or as they said, they're expanding into Riverton, Shoshone, Worland. You can make that appointment. You can through a provider referral, although it's not necessary, or by calling directly. So if you're in Worland, that number is 307-347-2449. If you're in Shoshone, that number is 307-876-0221. In Riverton, it's 307-854-7501. And there in Hot Springs County at Thermopolis, it's 307-864-5534. We want to thank therapist Kayla Sterling for joining us. It's a great addition. You are a great addition, not just the position, but you yourself here to the community of Central Wyoming and Hot Springs and Fremont County. It is a need. It is a need that I think for the first time, maybe ever in a rural environment that I've been in, that the need is, more people realize there's the need than anything else. And now they've moved on to the how do we get it? Because, there's a certain type of person who's going to move to Hot Springs, that's going to move to Fremont County, because we don't have like the 18 million things for teenagers to do or families to do. If you're one of those people who's like, I hate hunting, hiking, and fishing, well, you just eliminated quite a few things. So it's great that we realize the need is there, and we were trying to find a way to fill it. We welcome you here to try to help fill it, but of course, in my opinion, we need more of it, and I think that's where now the disconnect is we realize as a community we need it. Now, how do we go get it? That's a little bit different because most of us have never actually recruited people for a job. I say most of us. I have obviously here, but most people haven't, and most people certainly haven't done it in a medical environment where licensing and insurance and legal and regulation all comes into play.
Yeah, and we're taking a step in that direction, and I hope to keep growing the mental health piece of the program and have more availability with more therapists.
All right. Is there anything else you'd like to say? Say it to anybody. Want to say hi to anybody or anything?
I'll do a little shout out to my family, Joe and Susan Sterling, and my brother Jed Sterling.
Well, awesome, and we are welcome. We are glad to have their daughter and his sister here, and helping build the resources here and helping kind of get them not all under one roof, but where you can get that pointed in the right direction for resources all under one roof. Congratulations to you, and congratulations to the folks over at Hot Springs Healthcare for making this decision and going in this direction. That's going to do it today. Go ahead.
Oh, I didn't say anything.
Okay. I thought I heard something. That's going to do it today for WyoToday Newsroom on KDNO 101.7. Join us tomorrow at 8:08 a.m. As Sarah will join back as the host tomorrow morning on 101.7 KDNO.